I am Dr. Herman Sorongon. I'm a urologist practicing at the Davao Doctors Hospital. So today we're going to touch on the topic about prostate cancer. So a lot of people will be asking, what is a prostate? Okay, so every male, all males has a prostate. Okay, so this is already more present when the patient starts puberty, and then symptoms will start to arise when the patient gets older. There's two types of problem that arises from the prostate, and the two most common are the BPH, which is the benign enlargement of the prostate. So we will not be tackling on BPH for today, but concentrate more on prostate cancer. So with BPH, that's another thing. It's benign. Nobody dies of BPH. It will give you problems, but we can take care of that through medicine or surgery. But the other 15% of men will have prostate cancer. So this is the more dreaded part of the prostate problem. So talking of prostate, the prostate is a chestnut size organ just underneath the bladder. So any disturbance in the prostate will give you urinary problems. It is an uncontrolled growth of the prostatic tissue. So meaning when you say uncontrolled growth, it may the prostate cancer will not only stay in the prostate, but it can spread to adjacent organs, meaning neighboring organs, into the rectum, into the bladder, and even to the distant sites. And the most common area that this prostate cancer spreads to are the bones, especially the long bones, the spine, and then the joints. So it loves to go to these areas. That's why in patients who has untreated prostate cancer, usually they will suffer symptoms relating to the spine. Eventually leads to paralysis, leads to uncontrolled urination, uncontrolled defecation, severe pain because of bone metastasis. As of this time, there's really no straightforward answer to what causes prostate cancer. A lot of times, this is hereditary. So patients who have family history of prostate cancer, meaning if your grandfather, your uncles, your parents, your father has prostate cancer, you should have monitoring for prostate cancer at an earlier age. A lot of times, you will not know you have prostate cancer during its early stage. There will be no symptoms. So all males, this is very important, that reaching the age of 50 should have a test. We call it PSA, prostate specific antigen. It's a tumor marker that is extracted from the blood, and then you will see a number in there. The moment it is above the normal, then we would suggest biopsy. PSA will not tell you you have cancer or not. It will only give you a suspicion that you might be having cancer once the number is a little bit elevated. The normal is 0 to 4. If you have 5 and above, then you need to have a biopsy. However, for patients who have family history of prostate cancer, they should start PSA monitoring yearly starting at the age of 40. Again, there is no symptoms during the early stage. Symptoms only arises when the prostate cancer has already spread. It has already made its mark in different parts of your body. It can spread to the liver, the lungs, to the brain, especially to the lymph nodes. After a biopsy, nobody can be treated with prostate cancer unless you have a biopsy stating that you have prostate cancer. So it's not only, the treatment for prostate cancer is not straightforward. It's not something that you only have one treatment. There's a lot of treatment possible for prostate cancer, depending now on the stage of your prostate cancer. So it's very important that we diagnose, catch the cancer at its early stage. At its early stage, why? Because then we can offer cure. So a lot of people will say, can you be cured if you have cancer? Yes, if you catch it at its early stage. But how will you catch it if you don't do PSA? That's why it's very imperative that all males 50 and above should have a PSA. So treatment, we can offer cure if it's early. So after biopsy, we stage them. Are we dealing here with an early stage prostate cancer? We have a grading here. that we call Gleason grading. If it's an early stage, then the prostate cancer through bone scan and through CT scan shows that it's still confined to the prostate. We now offer curative treatment in the form of radical prostatectomy, in the form of external beam radiation treatment, and brachytherapy, and other forms of treatment, cryotherapy. These are now the emerging newer treatments for prostate cancer. Now, if your prostate cancer, the moment you went to your doctor, and then this prostate cancer has already been no longer is confined to the prostate, it has already spread to other parts of your body, then we cannot offer cure anymore, but we can prolong survival by giving hormonal treatment. And a lot of times they respond very well. Okay. So we have mentioned the treatment for the early stage and for the metastatic stage, meaning to say the late stage. We cannot offer a cure, that's why we give hormonal treatment. What will hormonal treatment offer? It will delay the progression of your prostate cancer. Some patients will live for another 10-15 years with hormonal treatment. But again, we would still opt for a better choice if these prostate cancer are managed during its early stage. So survival, we are now talking survival. Again, if you are managed early, then you survive. You are cured as if you never had cancer. Once the localized, meaning the prostate cancer is still small, we remove the prostate through radical prostatectomy, then you are cured of your cancer. But still, we need to monitor you with PSA regularly. However, if you went to your doctor and you have already metastatic prostate cancer, that's the dilemma here. We can still treat you, but we cannot promise cure this time. So for patients who have early stage, low-grade prostate cancer, we even offer active surveillance. What does this mean? No treatment at all. We just monitor your PSA, and regularly we do biopsy. No treatment at all, because remember, prostate cancer, some prostate cancers are very slow growing. No treatment, patients grow old with the prostate cancer being dormant. It never progressed, and they will die of other medical problems, die of old age, but not of the prostate cancer. So there are several types of treatment. Active surveillance is also one of them. So it's very difficult to say, how can I avoid? The only thing that a lot of literatures would always say is a healthy lifestyle. And a lot of times they would say avoid too much animal protein. And then patients who exercise a lot, have a very good physical fitness, these are patients who have lesser chances of getting prostate cancer. But sometimes it's really hereditary, family history really comes into play. Also, race. There are some who would say Asians has lower chance of prostate cancer as compared with Caucasians, especially the Black Americans. They have higher chances of having prostate cancer. So, since prostate cancer has no symptoms during its early stage, I would advise all males. So you inform your uncle, your father, your grandparents, friends who are already in their 50s to have PSA. It is readily available in the laboratory. Here in Davao Doctors, readily available. All you have to do is, it's not going to be difficult. It's only done once a year. Then if it's normal, then you do it again next year. Okay? So again, remember, cancer can be cured, prostate cancer can be cured if we catch it early. So don't forget, PSA yearly.